Good evening. Thanks for joining us. We begin with a nightmare experience in a North Vancouver hospital. The daughter of an 86-year-old man is speaking out tonight, angry about the lack of care he received. She says her father was left in the waiting room for 3 days on a stretcher before being admitted. And as CTV's Mary Cranston reports, the senior wasn't the only one.
The nurses need more support for sure.
It's a call to action we've heard for years, and more so during the pandemic. The headlines highlight the severe staffing and bed shortages at BC hospitals. But when Jolene Carlson's family was impacted, she couldn't sit by and do nothing. Her father, who has dementia, is suffering from cellulitis, a potentially serious bacterial skin infection. When the long-term care home he lives at sent him to be treated at Lionsgate Hospital, she says he was left in the waiting room on a stretcher for 3 days without being changed or properly fed.
My mom had to beg someone to come and change him because he was just laying. He was laying in dirty clothes, soiled clothes.
She says there were 14 other patients on stretchers in that waiting room and only one nurse to care for all of them.
It is not unusual to see vulnerable, frail seniors on stretchers, sometimes for days.
Seniors advocate Laura Tamlin-Watt says this is a mounting problem that likely won't improve unless significant changes are made in long-term care.
And when you don't provide preventive and ongoing care, seniors end up having a fall or they get acutely sick and end up in the ER room.
In addition to a lack of resources, the BC Nurses Union says healthcare workers continue to be overburdened by a vast majority of people who are unvaccinated.
You may not want to have that vaccine, but there are people around you, your elders, who you need to be protecting as well.
Elders like Carlson's father, who she'll continue to advocate for as long as she can.
If we all step in and we all say something, like, it has to change.
The Health Ministry and Vancouver Coastal Health did not respond to our request for comment. Mary Cranston, CTV News.